Well, here goes take 2 of this video. I actually had it on time lapse, so it was pretty funny when I went to hit replay and got to just see real fast mouth movement and no sound. Anyways, put me in a kind of funny mood. Haven't made a video in a couple of years. I was supposed to have microdiscectomy surgery back in February of 2013. It is now February 2nd. It's 1 a.m. February 2nd of 2015, 2 years later. We did not do the surgery 2 years ago. They said that the herniations in my back had healed themselves. Did have another problem the beginning of January and ended up in the emergency room on the 7th. One of the discs, I don't know if reherniated or I don't know what you want to call it, but I now have, in addition to what I've been dealing with for the last couple of years, of pain with a permanent impairment of the L5 nerve, also have a compressed S1 nerve in my right leg. So that leg has been pretty weak and pretty sore lately. Went to the hospital out in Surprise on the 7th. They did an MRI pretty quickly. Ended up calling my spine surgeon in Scottsdale. He said to transfer me over to Scottsdale, so got an ambulance ride from one hospital to the other side of town, where I got to visit with quite a few different doctors over there. They would have done surgery in the hospital right there and then. However, I did have an upper respiratory infection, so I stayed for a couple of days. Got released on the 10th, Saturday the 10th of January. And got to come home for a while, get better, rest, all that fun stuff. Went back into the surgeon, said he wanted surgery within 2 weeks. So today is February 2nd. Like I said, it's 1 a.m. I know I'm not going to sleep much. I do have surgery in the morning. Have to check in at the surgery center at 8:15. Surgery scheduled for 10:15. My original check-in was supposed to be 9 o'clock. However, they kept bumping it earlier and earlier. There is one patient before me, and the surgery center is thinking that that procedure won't take as long as the doctor has slated for it. So I'll probably get to start a little earlier. So it will be outpatient. So I'll go in, have the surgery done. It's supposed to be a 3-hour surgery, and then I don't know how much recovery time, whatever else, and then get to come home. I am in my living room right now, and I've got a setup. My husband came and set up a twin bed for me downstairs so that if I'm not feeling up to climbing the stairs with a sore back and who knows how my leg's going to be, I won't have to. I've got some options. I'm feeling pretty optimistic, at least about the leg pain. I understand from all the research that I've done that the leg pain will be pretty much gone almost immediately. However, I do also understand that the back pain from the incision, manipulating the nerves and the muscles in the back, that it actually is pretty horrific pain. So it'll be more in my back than in my leg, but pretty tired of the pain in my leg this last couple of weeks, since the 6th or 7th or whenever it was that I went to the hospital. Let's see, post-op appointment will be 3 weeks after surgery. I think I'm going to do a few post-op videos, probably not tomorrow, depending on how I feel. But I know watching a lot of the videos in the past, as I had mentioned in my other videos, it was very, very helpful to see what other people were going through, and I just thought I would do the same thing. Like I said, it's been a couple of years, so I'm back at it. Night before surgery, again, not going to sleep much, but just a few more hours to go. Thought I would send this, and then I will update you on how I'm doing sometime today after surgery, or tomorrow, which would be Tuesday. I want to lose all track of time. But anyways, just thought I would throw this out there, and hope you guys all have a great night, and I'll keep you posted.